Good evening. Threats of physical violence, equipment being thrown across rooms and, in some cases, racial abuse. None of that should be acceptable in any workplace, and yet it's the reality of what some staff in GP surgeries in South Yorkshire have faced.
And abusive behaviour is on the increase, so much so that Primary Care Sheffield has launched a campaign to try to encourage kindness. The latest stats show that 95% of the staff working in GP surgeries in South Yorkshire have experienced verbal abuse.
The government says it supports GP surgeries who report abusive patients to the police. Adam Fowler has our top story tonight.
The doctor has to have a look test.
They're the first port of call when we need to see a doctor, but increasingly staff at GP surgeries are subjected to physical and verbal abuse.
Oh, it's daily now, 3 or 4 times a day, whereas 5 years ago it might be a few times a week, but it's definitely on the rise. And the types of threats are getting more physical than what they would before. Somebody might curse you, and where I've had colleagues that have been racially abused and things like that, but now they're getting threats. Oh, I'm going to do your car, I'm going to stab you, I'm going to throw this at you. There's been surgeries where computers have been thrown at reception. So it's definitely getting more on the physical side.
The mental toll of relentless abuse can become unmanageable.
You just put the phone down and you're just like, sort of, I can't do this job anymore. That's how it gets you. It's just constant. And I've just had time off work with mental health because the demands are that high. So I've just been off for 7 weeks. Because you just get to the stage where you just feel like you're trying to do your best and it's not enough.
The latest statistics from Primary Care Sheffield show that in South Yorkshire, 95% of staff in GP surgeries have experienced verbal abuse. 34% have experienced threats of physical violence and 16% had experienced physical violence.
Ultimately, when that does wear them down, we do experience sickness in our teams because they can't cope with the abuse that they get when they come to work.
And what's the knock-on effect of that?
If you don't have staff in surgeries, then people can't get access, the phones don't get answered quickly enough, we reduce appointment times. So it causes a huge knock-on impact to the rest of the service.
Doncaster GP Professor Vijay Kumar is a member of the Royal College of GPs, which discussed the rising abuse at a recent meeting. He says he hasn't seen it this bad in 25 years.
One of the main reasons would be down to the long waiting list of 7.4 million people waiting for the hospital. Never in the history of NHS in my career have I come across this numbers waiting. The frustration seems to be taken out against primary care staff. Where else can patients turn to? And the inability of us to do more, other than the politicians are those who really need to make the change.
The Department of Health and Social Care says GPs have their full support in refusing to treat or reporting to police abusive patients. And they are working with GPs to reform primary care, cut red tape and bring back the family doctor. And last week agreed a new contract worth £13.2 million. A new campaign has now been launched in Sheffield to crack down on abuse and protect those who are doing their best to help. Adam Fowler, ITV News, Sheffield.